Basically, cerebral palsy is a clinical diagnosis. Investigations are required only to rule out other problems. The classic symptoms of motor dysfunction, with or without associated problems, will help us in diagnosis. There are certain clues to suspect cerebral palsy, which include prematurity or low birth weight, developmental delays, persistent neonatal reflexes, perinatal brain injury, movement and muscle tone abnormalities, language and hearing problems. The initial step in the diagnosis part includes the history taking. The family physician should collect the patient's data like exposure to risk factors, psychosocial factors, and family adaptation. The patient should be checked for respiratory status, motor function, body temperature, feeding patterns, weight loss, change in the physical stature, and concomitant medication, if any, in the past. Then move on to the physical examination. This is performed on the patient in order to conclude the cerebral palsy. This includes the posturing or poor muscle control and strength, or pharyngeal problems like swallowing, speech, drooling, and so on, strabismus or squint, tone, hyper or hypotonia. Evolutional maladaptation should be checked like delayed motor skills like rolling over, crawling, and walking, and persistence of primitive reflexes. One should also observe the reflexes of the patient like increased or exaggerated deep tendon reflexes. As we have diagnosed the disease condition, let us understand the treatment modalities involved in managing the cerebral palsy. There is no particular treatment to cure cerebral palsy. However, holistic and multidisciplinary therapy helps to improve the symptoms and life of the child with cerebral palsy. The treatment options include symptomatic therapy, surgical support, orthopedic support, rehabilitation, and vocational guidance. Symptomatic treatment should be given to relieve spasms and pains. Spasticity responds to baclofen orally. Tranquilizers and diazepam helps in athetosis management. Contractures can be managed with ortho interventions like plastic braces. Surgical support is provided in few patients who are unable to walk or in those with rigid muscles. It is performed to loosen the joints, relaxing the taut muscles, lengthening the tendons, and fixing the unusual curvatures of legs. Orthopedic support is provided to many patients. It involves the use of physical aids for posture balance and alignment of limbs. These physical aids includes the use of orthosis, braces and splints, posturing devices, and use of walkers and wheelchairs. Rehabilitation and vocational guidance are provided to all the patients. This includes speech and occupational therapy to improve the ability to speak and work on their own with disruption of daily activities. Vocational trainings are also provided for the young individuals so as to earn their living. The family physician is responsible for lifetime follow-up of the child with cerebral palsy. Counseling is provided to the patient's family and attenders to support the patient. The child should be encouraged for vocational educational training. Regular physiotherapy of the child is a must to prevent contractures. The family physician should be able to recognize various complications and should recommend for appropriate specialty therapy. In developing countries like India, most of the families cannot afford the maintenance costs of these children. There were several national and international organizations which support such children. The family physician must be aware of all such organizations and help the families in getting their help. We have reached the end of our discussion. Let us recall a few of the important points discussed. Cerebral palsy is a chronic neurological problem due to damage to a developing brain. It is the leading cause for the physical and functional disability in children and young adults. The presentation of cerebral palsy is mostly spastic, dyskinetic, and ataxic. Spastic variety presents as hemiplegia, diplegia, or quadriplegia. Patients with cerebral palsy mostly presents with motor and cognitive impairment, like walking, holding, sitting and learning, feeding, and attention impairment, respectively. Diagnosis is usually made through antenatal, peri, and postnatal history, and physical examination of the child with cerebral palsy. Treatment is multidisciplinary and involves vocational training and rehabilitation as core objectives.